refugee women who are unable to speak the native language or who come from less affluent parts of the world are at an increased risk of higher maternal mortality and poor perinatal outcomes. We have come together as Women Political Leaders Global Forum to put forward constructive proposals and recommendations to the Commission and the Council of Health Ministers of the European Union.
The law is one thing, the reality may be quite different. Despite this international obligation, pregnant women within vulnerable groups encounter difficulties in accessing prenatal and postnatal health care, or they are just given emergency care and nothing else.
President, I assure you that we will look very closely at your declaration and we'll make sure that it reaches the other member states and health ministers across the European Union, so that Commission and Council will certainly take up this issue over the next few months.
I have the impression that we can really create some impact by bringing forward the messages to the ministerial level and the EU Commission, and it's the beginning of a whole policy series on this.
While we know that the vast majority of maternal deaths do occur in developing nations, we see that across Europe it still occurs. So in 2015, I believe the number was about 1,800 deaths from maternal mortality in Europe in 2015. These women who are moving through Europe are not having access to the full set of antenatal services.
So we need to provide psychologists who have a background in culture and language who can understand these people. One, we need to have doctors, midwives, who know what they're facing when they have to face these people.
What I really appreciated in this context was really the composition of the group, which was extremely successful. It's very important to combine the participation of parliamentarians with policymakers with technical agencies and with other stakeholders, including the private sector, including the civil society, that can somehow share experience.